Hello, and welcome to the special webinar series with the Lancet and CUGH on global health. I'm Keith Martin, the Executive Director of the Consortium of Universities for Global Health, and we're very pleased today to have two outstanding editors within the Lancet family of journals, Ms. Zoe Mullen, editor of the Lancet Global Health, and Dr. Alistair Brown, the editor of the Lancet Planetary Health. Now, this series of webinars came out of discussions with Ms. Mullen. It was her brainchild to try to figure out how can we address inequalities in access to knowledge and global health leaders and experts. How can we ensure that individuals who may not be able to travel to our international conferences and other events, how can they be able to engage with experts in a more equitable fashion? So Zoe came up with this idea for having a series of webinars. So today, what we're going to do is have a discussion about how you can get published, trying to figure out what is the mercurial world of getting published, what happens in journals, what happens when you submit articles for publication. And understanding this, we hope it'll give everybody on this particular webinar greater knowledge about how to be able to present their articles in a way that has a greater chance of being published. So what we're going to do is I'm going to turn it over to Ms. Mullen in a second, followed by Dr. Brown, and then I'm going to follow up with a little bit of a brief about the Consortium of Universities for Global Health, and then we're going to turn it over to you to ask your questions to both Ms. Mullen and Dr. Brown. So with that, it's my pleasure again to introduce Ms. Zoe Mullen, the editor of the Lancet Global Health. Zoe, over to you.
Thank you very much, Keith. Maybe Jenna, if you could move this first slide on, please. So it's a pleasure to be here talking with you this morning or afternoon or evening, wherever you are. I'm Zoe Mullen, the editor of Lancet Global Health, and we're going to be talking to you today about a few topics that hopefully will be helpful when you're thinking about not only writing your research papers, but thinking about coming up with an idea for a piece of research in the first place. So we'll sort of be talking about how to get inside the head of an editor and what the decision-making processes are that we go through that will hopefully be helpful in giving you a better chance of getting a high-impact publication, not necessarily in the Lancet, but in any journal that you want to aim for that you think is a good journal for your piece of work. So we will give you a brief introduction to the Lancet family, to our particular journals, and the types of article that we publish. Then we'll go into a little bit of the inner workings of the Lancet editors here in London, how we go about making some of the decisions that we do on the manuscripts. We hope you'll come away knowing that we do think deeply about how we make these decisions. We don't just make them lightly, particularly those where we don't choose to publish. And we'll finish with what we think perhaps makes a good global or planetary health study. Next slide then, please, Jenna. So first of all, for any who might not be familiar with the Lancet, we thought we'd give you a brief introduction to what it is, what it was, what it continues to be. And it's a kind of strange name for a journal, if you think about it. So the gentleman in the center there, this is Thomas Wackley. He is the founder of the Lancet back in 1823. He was a surgeon and a reformer in the UK, and he really wanted to shake up the medical establishment because he knew that there was a lot of nepotism and corruption in the medical world at the time, and he wanted to publish this journal that would shed a light on that and cut out some of the dross that was going on. So those two images there you see on the left, that is in fact a Lancet window. And the item on the right is a Lancet as in the surgical instrument. So Thomas Wackley wanted to produce this journal that encapsulated those two meanings of Lancet. So shining a light on the goings on and cutting out any of the nonsense that was happening at the time. So that's the Lancet, and we hope the Lancet family of journals now, as there are many of us, continues to offer not only cutting edge research, but sort of insightful and perhaps challenging commentary on what's going on in the world. Next slide, please. So as I mentioned, we are actually a family of journals now. Since the Lancet Weekly Journal was launched back in 1823, we've grown somewhat very recently into 18 journals. We have 3 offices. The main office is in London. Most of us are here, but there is also an office in New York and there's one in Beijing. And we have around 150 full-time staff. So we're quite unusual for most journals, I suppose, in having full-time editorial production and many other staff. So our motto, if you like, is the best science for better lives. So I think as we go through this presentation, that's sort of what we keep in mind, I think, editorially. We're trying to look at the best science, not just for science's sort of the interest itself or the academic interest, but something that's actually going to make a difference. So something that's going to make human lives better. Next slide. So the Lancet Global Health, then, we've been running now for nearly 7 years. This was the Lancet's first open access journal. So it was a little bit of an experiment running an open access journal because we'd never done it before. But I think it was important for us to do a global health journal and make it accessible. So we're really happy that we've been able to do that. So it's available online. Anybody is able to access any of our content without paying. There's no paywall. We're currently receiving about 1,700 submissions per year, and we're publishing 12 research articles a month. We have a pretty decent impact factor now of 15 and quite a few followers on Twitter. So on the next slide, I'll hand over to Alistair Brown, who's going to tell you a little bit about Planetary Health.
Hello, thank you. So the Lancet Planetary Health is a much more recent addition to the family, launched in 2017. And we were really launched in order to address this kind of neglected intersection of health and the environment, and not just environmental health, so not just the way that the environment affects people, but also the way that we affect the environment. And we cover and are interested in kind of all of the different aspects of the Sustainable Development Goals. We're also online only open access journal. We haven't talked about the fact that there is a publication charge. So for both journals, so it's not free. Obviously, there's a publication needs to be paid for either through a subscription model or through an open access article processing charge fee. So both the journals operate through that mechanism, but we have a waiver for situations where people can't afford to pay. That's really it for my introduction to Planetary Health. Planetary Health is a kind of a very large conceptual basket that incorporates an awful lot of different issues, and I think that we're particularly interested in the kind of intersection of those different issues. Issues which are usually not seen or dealt with together through traditional disciplines. So next slide, please. This is me, right? So I'll just talk you a little bit through the kind of the main article types, and just so that there's a little bit of transparency about what they are and what we expect to see in those different types. So the first one is probably the most important category in a way, which is the primary research, a research article, as we'd usually call it, and that also includes synthesis research, so things like meta-analysis and systematic reviews. Full systematic reviews fall under the category of primary research. And this is the category that we're going to be talking about most today. So, and we're assuming probably that most of you are interested in submitting your research for assessment. But we do also publish some different article types. So correspondence is basically letters to the journal. So that's often just a very short note on something, perhaps something that's topical, or it might be linked to a previously published paper, some kind of comment on something that we published before. We also publish comments, which can, in most cases, they're unlinked comments, so they're short, sort of informed opinion pieces, which are designed to highlight important issues, which are either have a policy element or arise from new research findings. And we also have linked versions of those, which are usually linked to a paper that we've published in that issue, which give a little bit of a kind of a broader contextualization of why that paper is interesting and what it means for the field. We also publish narrative reviews. So these are written by people who are synthesizing the latest developments, usually in a kind of a rapidly developing field of research. So where there's been some progress recently, but perhaps that progress, all those new insights haven't been tied into kind of a coherent view yet. There's a lot seems to be in the air. And when we identify those kind of areas, it's often good to try and get someone to review that literature, bring that together into some kind of cohesive understanding of where we are, what else we need to know. We also have these pieces called personal views, which are essentially slightly more focused reviews. They're usually a little shorter, and you're given a little more leeway to have a kind of a personal perspective. And they often are allowed to be a little bit more sort of forward-looking, like this is where we think this field needs to go, something like that. News features are something that, I like blue section, so they're essentially commissioned and they're written by professional writers, freelancers usually, and they're, as you'd expect, like short news pieces that highlight what we think are important issues that our readers will be interested in knowing about. Within Planetary Health, we published this thing called the Planetary Health Research Digest, which are short summaries of papers that we found within the month that we just think are interesting and that our readers would like to hear about. Would you like to talk about the last two?
I can pick the last two up. Yes, so the Lancet Global Health also publishes health policy pieces and commissions. So health policy pieces they're usually pieces of research, but slightly smaller in scope, and they're very policy focused, as it suggests. And then our commissions, we've just published our first commission a couple of years ago on high quality health systems. This was a commissioned commission, so I thought this would be a great subject for a commission. And a commission is essentially a large report that has quite a reasonably meaty new findings element to it. So it's not just a large review, and there is something novel about it, but it is very focused on changing policy. So again, it's something that has a clear sort of overarching aim, and the idea of a commission is to sort of galvanize policy action and further research potentially. So as I said, these commissions are usually thought up by the editors and commissioned of particular researchers, who then recruit a diverse group of commissioners, or they can actually be suggested by researchers themselves. So actually I have 2 commissions currently in the pipeline that have been suggested by the authors themselves. So that's nice. Next slide, please. So now we'll go on to the inner workings of Lancet editors, but also I think this can also go for some of the other high impact journal editors. It's kind of not particularly Lancet specific. I think any high impact journal will be looking for this type of thing in what they're looking for. So if we can have the next slide. Next slide, please. Thank you. So this actually is a Lancet specific one, just to give you an idea of what's going on here in the office. So the Lancet Weekly Journal and the specialty journals, those 18 sister journals, all have an editor-in-chief, and then they may have a sort of another layer of executive type editors as well. That editor-in-chief will be they're all full-time, as I mentioned. This is their professional job, and they're responsible for the sort of strategy, policy, decision-making, the ultimate sort of buck stops with me kind of thing. We also have advisory boards, and these are external advisory boards that you might be familiar with as the sort of editorial board of a more academically run journal, but these members don't actually do any of the kind of peer review. They don't get involved in day-to-day decision making. They are purely advisory. So if we want to make a sort of strategic change of direction to the journal or some new policy, we might refer to this advisory board for just to get a kind of sanity check from people in the kind of the real world rather than editors sat in an office. Then we have a large group of peer review editors, and these are the guys that do all of the finding of expert peer reviewers for your papers. And so those editors will obviously be liaising with peer reviewers, they'll be liaising with authors around revisions, and then they'll also be liaising with our technical editors. So in the Lancet and also in the other sort of high impact professionally run journals, there is a big bank of technical editors. So they essentially do another round of almost peer review once your paper is accepted. And they will edit the text for language. Yes, so if your first language isn't English, it's not usually a problem for us because our technical editors can help you to polish the language. They make sure that it makes sense. So if what you say in the text is one thing, it is actually reflected in your tables and figures, for example, that it's consistent, and that everything basically is as accurate as it can be for when it's published. Then we also have a team of in-house production editors, and these are the ones that make the pieces look lovely. So they will format everything. Most of the illustrations are redrawn in-house, and then they will do the necessary for making the articles go online. Next one.
Editors-in-chief are often also peer review editors, usually also peer review editors.
It's true. It's true.
Yeah. Okay, so what do we do like day to day? What are the actual tasks that editors, professional editors do? And so perhaps our kind of core tasks, and usually the first thing you kind of need to get to in a day is reading new manuscripts submitted, the new manuscripts submitted, and doing a kind of an appraisal of those and deciding whether we want to select them for peer review or desk reject them. So we decide they're not suitable on editorial grounds without the need for peer review. If we decide that they are suitable for peer review, then we need to select the reviewers, appropriate reviewers, and get them to agree, and then oversee that review process in terms of getting the reports back to the authors, getting the authors to revise the manuscript, and then sort of arbitrating any disagreements there might be between authors and referees. And then we make final decisions on the manuscript, whether we're going to publish them or not. And then within that, there are also various kind of article quality and journal policy checks and that we need to do. But in addition to that, there are also some other tasks that editors can get involved in. One is commissioning and editing linked comments, which I talked about a little bit earlier. So often, if we have a paper that we think is a really interesting paper and that might benefit from some kind of translation or just a little bit of extra profile, then we might commission someone, often one of the peer reviewers of that paper, to write a kind of a linked comment that provides a little bit of extra kind of contextual understanding of why that paper might be interesting, why you might want to know about it. And then often those need a little bit of developmental editing when they come in. Then we also write certain content, or can do, depending on how busy we are, basically. So for example, within Planetary Health, we write the Research Digest in-house, and then news features are usually commissioned, but sometimes news features or interviews or articles like that, pieces like that, can be written by the editors. I talked already about reviews. Many of our reviews are commissioned, so we have to identify areas that perhaps would benefit from some synthesis and approach suitable authors and agree on some kind of outline. And then when it comes in, there's a kind of a developmental editing process there, as well as peer review. Obviously, writing editorials, papers that we think are, and that we hope are going to be impactful. We often help with the preparation of press releases to represent that paper in the way that we think is kind of going to give it the best chance of being properly dealt with by the media. So sometimes we press release papers because we think they're particularly noteworthy. Sometimes we press release papers because we want to caution that it doesn't get misquoted, with varying degrees of success, because the media will do what the media does. But if we write a press release which is suitably caveated, we at least do everything that we can to make sure that the media pick up on our papers in the most responsible and appropriate way. I think the kind of the press wing and the kind of the press impact is one of the value adds that you get for coming somewhere like the Lancet or other selected journals. And then, of course, in order to be able to make these decisions, in order to be able to be well placed, even though as professional editors, one of the key things that we have is independence, right? We're not tied to any kind of particular organization or any kind of vested interest. We're not likely to be associated with any competing research agenda. But we're also that independence also means that we're somewhat removed from certain areas of research. So a way that we try and maintain contact with the research community and with policymakers and people in the private sector is by going to institutes, conferences, and just trying to stay in touch with people and work out what's going on, keep our ear to the ground basically, and make sure that we're aware of perhaps if there are kind of schools of thought issues or kind of disagreements or controversial issues within the community. It's useful for us to kind of get to know what those are, so we can bear that in mind when we understand perhaps disagreements between referees and authors and those kind of things. Okay, next slide, please.
Right, so this is a kind of scary looking image of what manuscripts, what happens to them at the Lancet. So it's just to illustrate that, we do get a lot of submissions. We get around 9,000 submissions. This is the main Lancet now I'm talking about here. And that each sort of step of the editorial process, which we'll go into a little bit of detail about in a minute, some papers fall by the wayside, so that there are around 75% are left after an initial desk reject by the editor, and so these will be very obviously out of scope papers, but we'll go into some of these levels of triage in a second. And then there are various in-house meetings where groups of editors, so it's very seldom one editor making a decision about papers that pass the first hurdle, will be discussing the fate, whether they should go for peer review or not. And then once they've come back from peer review, there are further editorial meetings to discuss the reviewers' reports and what we should do with them, whether we should, because often obviously reviewers don't always totally agree with each other, so there needs to be a degree of input editorially as to how to handle them. So revised papers can also be rejected if we don't feel that they've adequately, the authors have adequately addressed the reviewers' points, and we can also send papers back for further review after revision. So there are various processes, and at the end, we only end up with around 4%. This is the Lancet main journal being accepted. So I think this is just to illustrate that, if you did submit a paper to the Lancet and didn't make it through, you'd essentially be in very good company, because most people, don't get through to the Lancet. But so this, I don't think this webinar should be seen as a how to get published in the Lancet piece, because we can't guarantee that, having followed our advice, you would definitely be published in the Lancet. But it's just a way, as I mentioned earlier, to think about how to get inside an editor's head and make sure that your piece of work goes to the best journal that it could possibly get to. Next one, please.
Okay, so this is just to kind of illustrate that while, so because we have all these manuscript meetings where we discuss manuscript outcomes, both pre-peer review and post-peer review, there's opportunity for manuscripts to be kind of channeled within the company to different avenues that we think are perhaps more appropriate. So maybe typically people would shoot high and go for the weekly, and then the weekly might decide a pre-review that's not suitable for us, but perhaps it's going to be interesting for Global Health or for the Lancet Planetary Health. And so then we can discuss that. Yeah, okay. So just to backtrack a little bit, if you look at the top of the slide, we've got the Lancet, and then arrow goes down to editorial rejects, and then arrow goes down to a whole bunch of boxes in the middle. Each one of these boxes is one of the specialty journals. I won't read them all, I won't name them all, but there's a number of specialty journals, Lancet HIV, Public Health, Global Health, etc. And they're the kind of like second level impactful, if you like, after the weekly. And then at manuscript meetings, we will discuss whether it's possible for whether a manuscript might be more suitable for one of those journals. And then we discuss with an editor from that journal. And if we think it's suitable, then we'll invite it to be transferred across. Or if we don't think it's suitable for one of the specialty journals, then we might think it's going to be more suitable for e-biomedicine or clinical medicine, which are other open access in-house publishing avenues, or possibly if it's not seen to be suitable for that, then we might pass it out to some of the other Elsevier journals for consideration. So even if you don't get into the journal that you kind of initially want to get into, it's still possible that we might find another home for the paper within the family of journals. Anything to add?
No, I think that's it. Yeah, it's just to say that, you know, we try, and we don't want to be losing good research, and so that I think that's one of the reasons that we set up these specialty journals, so that some of those many 96% of rejected papers might find a home somewhere else in the family. So yeah, that's it.
Great. Next slide, please. Okay, so we're going to just try and get a little bit more into the kind of the headspace of an editor, and try and explain a little bit why we apply the criteria that we do, what the criteria are, and what we're trying to achieve when we apply those criteria. So next slide, please. So I think you can, as I think that the slide that Zoe showed a couple of slides ago about the editorial process and the proportions of manuscripts that get rejected at the Lancet at each stage, there you can kind of think of it as there's essentially two hurdles that a manuscript has to get over in order to get published in a Lancet journal. The first one is an editorial threshold, and that's where most manuscripts fall down. So the first hurdle is the hardest hurdle in a sense. So we'll spend a little time explaining why that hurdle exists and how we go about establishing it, and also why we go about establishing it. So it sounds very simple. The first hurdle is the editorial threshold. So a manuscript comes to an editor, or gets assigned to an editor, and then we read the manuscript, and we will try and understand what have they found and how does that relate to the existing literature, and then how significant is that advance compared to what was done before, and does anyone care? You know, what does that mean? Is it impactful? Is it going to affect other fields? Is it going to affect practice in a certain field? These are the kind of assessments. So, and in doing that, we kind of try and tick two boxes. So the first one is conceptual novelty. So we're just trying to understand from the findings of the paper, do we learn something that's new? Is there something conceptually new? And that can be important within its own field. It doesn't necessarily have to have, you know, enormous wider impact. If it's really new and fresh within a field, then that's a really big positive tick in its favor. But then we also are looking for that kind of like general wider interest. We're looking for those papers that are likely to have impact beyond an immediate field, because if their impact is primarily within a certain field, then they're quite likely to be well served within a specialty journal that's only read by people in that field. The reason that you might want to go into a kind of a more general interest journal or broader reach journal is because you want to influence people, and you're only going to do that if it interests them, so it has an impact for them. So these are they're the kind of primary things that we're trying to look for, and you'll hear that you know, I'll probably kind of repeat this quite a lot, but it's essentially we're looking for conceptual novelty of the findings, not necessarily the analysis. So we're not so interested if the analysis is new, although new analysis can lead to new findings, but new analysis that confirms existing findings is not necessarily going to be as conceptually interesting. And then we're looking for that kind of that wider interest, perhaps tying into a really important policy issue at the moment, or a health issue that's really current or just long-standing and important. And we're also, of course, looking for, you know, strong support for conclusions. So you can't just be saying things that you can't just ask interesting questions. You actually have to provide some answers and support them. Often we like some mechanistic insight, because that often allows, you know, like predictive ideas to be explored. And then obviously we work that inspires future research, not just in the general sense, but in the specific sense, that identifies important new avenues. In these cases, the decisions are made by the editor before they go to peer review, but we can also, after peer review, we can also decide that actually this is not as interesting as we first thought. And because we have this editorial threshold, there's a bit of a tendency for people to kind of claim big And then when a manuscript goes to peer review, the reviewers say, this is an interesting paper, but you can't really say what you've said. You need to kind of scale back your claims. And then once they've done that, in order to address the referee's concerns, the paper comes back to us. We might say, okay, I can see that this is going to be publishable, but unfortunately it's not as interesting as we'd originally hoped. And so we might editorially reject it after review, even though it's fundamentally a sound piece of research. So I suppose what I'd emphasize is that we're not, I think it's most useful to see editors not as gatekeepers, but as kind of a proxy for your readers. So you're trying to, usually what you're hoping to do with a piece of research is to have an impact on the world, to publish something which is going to help change practice, help change policy, help inform something on the ground. And so in order to do that, you need to be able to speak to a broad audience. You need to be able to reach beyond your immediate peers. And so we're a kind of a proxy for that readership. So if you can convince us that this is novel, you found something new and it's important and it's going to be useful, then we'll send that out to peer review and hopefully they'll agree. Next slide, please. So if you've got over the first hurdle, well done, because you're probably one of the kind of 20%-ish who's got over the first hurdle. So it's very common if you submit to a Lancet journal, one of the other selected journals, not naming any Nature Science, for example. It wouldn't be unusual for you to hear back within a few days or a week saying we've decided not to send this to peer review. And that's not a judgment on the quality of the research, it's a judgment on whether it's impactful enough to have that kind of wide interest. So basically, yeah, and we do that quickly, partly because we know that people's experience is mostly going to be negative. So we want to make that as painless and as quick as possible so you can then go and find another home for that piece of research. But if you do get over that hurdle, then we obviously need to check that it passes its technical threshold, because the editors, we might have some background in some of these areas that we're covering. In the case of planetary health, I can't possibly have expertise in all of the areas that I'm making editorial decisions on. So we obviously need to send it out to peer review to check that this is actually a solid, robust piece of work. In those cases, we send it to a minimum of 4 referees. Usually, certainly in the case of clinical papers, one of those is a statistical referee. Sometimes they might be more methodsy. It's a single blind process, so that means that the referees' comments are anonymous. The authors don't know who the referees are, but the referees do know who the authors are. In selecting referees, we try to find obviously experts in their field, but we're also trying to find people who aren't conflicted, so they don't feel biased. They're not biased by personal or professional relationships. And we select sufficient referees to cover all aspects of the paper, so that's usually covered within 4 referees, but sometimes we need more if it's a complicated paper. We use different methods, different and complicated approaches, particularly in planetary health. We often have multidisciplinary papers that use really quite different expertise that's not commonly found working together. Those papers can be a bit more challenging to get peer reviewed, and sometimes we need extra peer reviewers. But ultimately, we're looking to find unbiased, balanced, objective referees. We do respect authors' requests for exclusion, so within reason. So if you say, I'm concerned that this other lab is doing work like ours and we'd prefer you not to send it to these people, then we would respect that, but you can't exclude everyone. So it has to be kind of within reason. We try to avoid any recent co-authors, PhD supervisors, close colleagues, anyone that you've, and we do some searches to check that people have recently worked together as far as possible remotely, and also using our knowledge of the field that we gain over time. We strive for diversity in our referees, so obviously we're talking about 3 or 4 people, 4 or 5 people usually, but we try to get some gender and geographical diversity in that to make sure that the viewpoints represent a kind of a wider view, not just a kind of a niche view held by a certain number of people in a certain location, for example. And of course, as I said before, we go to conferences and talk about and try and meet people working in these fields and work out some of the undercurrents, some of what's going on in these areas, and perhaps some of the controversies that exist. Okay, next slide, please.
So now I'll talk a little bit more specifically about some of these different hurdles and stages of the editorial decision-making processes. So I think the first one obviously is the relevance to the readership, and so we do have an editorially defined aim and scope. So I guess the first thing to do when you're thinking about a journal to submit to is to look at the information for authors, and do read the sort of thing that these journals publish. So Lancet Global Health, we publish original research, commentary and correspondence, and our focus is on disadvantaged populations. So that can be whole economic regions or marginalized groups within otherwise prosperous nations, as we state. So we see global health as being all about inequity. So a piece of work that looked at breast cancer in Indigenous people in Australia would be interesting to us, because although Australia is a high-income country, Indigenous people are relatively disadvantaged within that country. So that for us would be interesting. And then Planetary Health, do you want to quickly run through that, Al?
Yes. So we have, it's a little bit harder to kind of neatly summarize our remit because it's so kind of broad and encompassing, but we have this kind of this idea that we want our research, we particularly favour research that kind of contributes to our understanding of and transition into a safe space for humanity, both in terms of the planetary boundaries, so that's the kind of the environmental constraints on a healthy society, and also the social and economic foundations that are required. So it really encompasses all the Sustainable Development Goals, both in terms of our impacts on the environment and those impacts back on us, but also taking account of the social and economic things that make a difference, and particularly the intersection of those two, because in general we're very bad at looking at them together. So lots of the focus on sustainable development and sustainability in recent years has been trying to integrate these ideas of the environment not being some abstract notion and divorced from other practical activities in life, and particularly as the environment starts to get increasingly degraded to the point at which it's becoming a very tangible material risk to people, either through climate change or through habitat degradation, water resources, these kind of things. We're really trying to we're really interested in work that deals with these issues head on. Yeah, that's probably as succinct as I can be.
Good. All right, so that's yeah. So basically, look at what the journals says it likes to focus on, and if you're not really within that, then yeah, you really choose somewhere else. Otherwise, the outcome is likely to be a bit obvious. Next slide, please. So I'm gonna whiz through these quite quickly because I'm conscious of time, and we would like to allow some decent Q&A time. So Al's really sort of mentioned this already, but we do like it to be something we're going to publish to be reasonably novel, and we don't mean sort of a brand new drug or a vaccine or something that's never ever been shown in any human being before. But there does have to be a new element to it. So what does it add to existing knowledge? You could have done an intervention in a different population from what's been discussed or investigated before. So maybe a particular intervention has been assessed in adults but not children. So that would be a novel finding, novel enough for us. Maybe something's been shown in a high-income country, but never in a low and middle-income country. That would be interesting too, as would something that's been shown in urban but not rural environments. So you can see that it doesn't have to be brand new, but there has to be a new element for a journal like the Lancet or the Lancet family of journals to be interested in. So it could be a new method, it could be a new piece of modelling about the future, but what sort of really makes our hearts sink is to get to the end of a manuscript, and for the sort of conclusions, the interpretation, to really have culminate in the statement, these findings confirm the work of somebody else. So if that's the case, and I think it's always important to reproduce work, but really if we already kind of knew the answer to the question, it's not going to be something that's interesting to a Lancet type of journal.
Yeah, I think the only exception to that would be if the confirmed findings were very preliminary and you had a really robust new data set that really was much more, much firmer basis than was previously known. Exactly.
Yeah.
But yes, so you wouldn't want your main kind of findings to be, we reinforce what we already know, which is of course a really important part of science. So we're not saying that there's something wrong with papers that find that, but they're just not likely to have that kind of wide impact that we're looking for. So they're likely to be published in the more specialist literature where you're speaking directly to the people who are going to be interested in knowing that their findings are confirmed.
Right. Next slide, please. Al's already mentioned this as well, but we are looking at once we've kind of got down to the, is there something new here? We will have a look, and this is even before we send for peer review. We're having a look at the methodology. So, have you got a decent sample size? Is there enough statistical power to make the conclusions that you're making? What's the design of the study? If it's a case control study, what are the controls? What are the assumptions you've made there? If it's a piece of modelling. If you've done a questionnaire study, has that questionnaire been validated in the particular population you're looking at? So we will have a quick glance over the methodology, and if it's something like a systematic review, a randomized controlled trial, these are the sort of top levels of evidence, and so we will be interested in these types of study more so perhaps than the ones further down that pyramid there, such as those that are really based on expert opinions or case reports with relatively small numbers. Again, we wouldn't discount them outright, but this is what we're thinking about when we're looking at a paper. Next.
You need to make the case really strongly for some of the things towards the bottom of the pyramid, I guess.
I think so, yes. If it's something that's very rare and new, then I think and there's not obviously there's little research to do a systematic review on, for example, then some of the sort of slightly lower level evidence would be interesting. Yeah. Next, please. And then I think again we're looking at what's the point of what you've done. We're looking at something that you can tell us that your research has shown that will be able to move something forward. Is that policy? Is that practice? Is it just principles? What is the missing piece in the research puzzle that your manuscript adds? And this is something that I think people sometimes lose sight of when they're writing up their manuscripts, but you really do have to make sure that's very clear in your write-up, and not just in the covering letter. I think this should be something that's very clear from the manuscript itself, from the abstract and from the rest of the paper. And as Al has mentioned, it's not just for editors. If this is going to be interesting to us, it's going to grab our attention and make us maybe want to send it for peer review. But ultimately, you want to be showing your readers, your peers, that your research is important. And so you need to be able to get that across when you're writing up your work. Why is it important? What impact is it going to have? And what is the point? So again, if we get to the bottom of the sort of the end of the manuscript, and your main conclusion is that more research is needed, I think again it's probably not going to be particularly high on our agenda in terms of wanting to publish it. We know more research is always needed, and I think maybe if you can demonstrate that your piece of research has opened up new avenues for research, and you can demonstrate that, that's good. But if the best thing you can say about your research is that more research is needed, you haven't really answered the question adequately that you set yourself out to answer, then it's not going to be for a high impact journal. Next slide, please. So we've actually now asked authors to make this very clear by putting together a research in context panel. So we're trying to prompt people to actually spell this out. So we're asking them to complete this panel to telling us what evidence was available before the study. So if you can, do a systematic review before you even start your research, to make sure that you're not answering a question that's already known. And then we ask you to flag up what that evidence is, what your particular piece of research adds to that evidence, and then what the combination of your new evidence and the existing evidence, what the implications of that are for policy, practice, future research, etc. So we're trying to sort of help you to I guess make that case to editors, but also to readers and peers. Next, please. So we're getting to the end now. So what makes a good global planetary health study? Next one, please. I think for global health, we obviously want to look for papers that, as we've just mentioned, are identifying and attempting to fill gaps in knowledge, so that missing piece in the puzzle. We like them to have a sort of be able to have some sort of wider context. So they, you know, if there's a study that's international, it's multi-country, it's almost maybe covers all the countries in the world, that's truly global, okay, but not everybody has the wherewithal to do that kind of study. But if you can in some way help us to think how that research could be generalized to another context, that would be useful. We're looking for things that are feasible and sustainable. So we're looking at usually low and middle income country settings. So we need to know that whatever you've done in those settings are feasible going forward. So what we're really not looking for are sort of papers that seem to be very project centric. So something that's been perhaps thought up in a institution in a high income country, it's been done in a low income country, and then the end of the project is the end of the research and any assistance or benefit it might have had to the community. And on that note, we are looking for papers that do make use of in-country expertise and gives due credit to it. So we are, you know, not considering anymore papers that have a solely high-income country authorship if the study's been done in a low-income country. It's not feasible that you know, the expertise within the country of the study has not been involved in some way, and so to be excluded from authorship we feel is wrong. So so we're looking for due credit and hopefully a study that could be replicated elsewhere. Next, please.
Yeah, I mean, I think so. Just to quickly talk about maybe some of the slight differences in our focus for planetary health and things we're looking at. I mean, there's a lot of similarity, there's a lot of overlap in areas that we'll be looking for a lot of the same things. I'll just kind of re-emphasize that we're very much thematic. We're very interested in kind of intersecting issues. So for example, climate change and food security, or food security and water security, and how different disciplines or different sectors that rub up against each other are actually considered together rather than being considered separately. We're interested in kind of priority issues, so issues that kind of have real world importance now. I mean, I guess we all are. Often the thematic nature of the journal means we're often interested in multidisciplinary work because that's the way that you answer these questions that the world is now demanding of us. We're not kind of obsessed with it. Interdisciplinarity and disciplinary work can be important, but very often and sort of increasingly, we need a kind of a team science approach to these projects, which utilizes different and brings them together from the very outset of the project, not just kind of like, oh, I need a stats person at the end kind of thing. Like we're looking at how, for example, can water resource modelers get together with people working on WASH to look at how climate change and demographic factors are coming together to affect practice in a certain region, these kind of questions. And we're interested in addition to those kind of like modeling papers, we're also interested in kind of very practically focused issues. So things about the importance of issue framing or science communication, for example, or implementation studies where they've looked at how successful implementation has been. So there's some of the kind of like, some of the sorts of things that we're looking for planetary health. We're pretty open-minded, to be honest. Okay, next slide, please. So yeah, just to kind of like wrap up, I think we would advise you that if you think that you have a potentially impactful paper, what you perceive to be impactful, useful in the world, that could be a Lancet journal or another high impact journal paper, we would suggest that you ask a friendly, but someone that you would consider to be kind of brutally honest friend or colleague, ideally from a completely different discipline, or at least substantially different enough that they've got a kind of a fresh perspective outside of your colleagues in the immediate field, if they find that interesting. Is someone from a different field going to find that interesting? Ask yourself, if you were to referee this paper, would you find it acceptable? And if the answer is yes to both of those, then write it up as briefly as you possibly can, explain in a cover letter why it's of interest, why it's of general interest, and also within the RIT panel you can address that. And the cover letters are great, in place to kind of persuade the editor, if you like, and submit through our website, and we'll get back to you very quickly with our thoughts.
So that's it, I think. So I'm going to hand back to Keith now to give us a wrap up before we go into Q&A.
Thank you very much, Zoe and Alistair. That was a superb overview for the audience to find out what goes through the minds of editors and the process you engage in to sift through the publication, the submissions that come to you to ultimately be rejected or go through into publication. So thank you for that. And so everybody on the webinar right now, please get your questions ready, and we'll pose them to Zoe and Alistair in a second. Before we do that, a brief overview of the Consortium of Universities for Global Health, a very brief overview, some highlights. We have 186 academic institutions in over 35 countries. We're based in Washington, D.C., and our mission is to improve the health of people and the planet, which you've heard very clearly by both Zoe and Alistair, is how we can address issues that improve both of those enormous challenges. And we work across research, education, advocacy, and service to achieve our mission. A couple of things just for your note. Our big annual conference is coming up in Washington, D.C. on April 17th to the 20th. You can take a look at the program, register, and come and attend both the satellite sessions on April the 17th, which are free to attend for the most part. You can see all of that at www.cugh2020.org. And Zoe will be there, by the way, running some very superb sessions at the conference. But we expect to have nearly 2,000 people from more than 60 countries. It's a must-attend event for people in the global health community, if you can do so. And we hope you'll be able to, again, to attend the conference, as well as the satellite sessions on April the 17th. Just make sure you take a look at the website and please come and attend if you can. We run a number of grants on training, on advocacy and public engagement. We have working groups on an array of issues, from planetary health, One Health, and environmental health, to oral health, palliative care, humanities. There's lots going on at CUGH. So in the interest of time, what I'll do is just get some questions ready here, and we'll pose them to both Zoe and Alistair, and we'll get started right away. So the first question I'm going to pose to Zoe. Zoe, how do you become a reviewer for any of the Lancet journals?
Great question. So as I mentioned, I think Al mentioned actually that we have a broad range of reviewers, but we don't have a pool of reviewers. And I think this is quite perhaps a little bit unusual for some journals, that there aren't a set number of people that we return to time and time again. So actually one of the things that the peer review editors do is basically a bespoke literature search for each paper. So any paper that we've chosen for peer review, we will go and look for the best reviewers for your article. So that means looking for usually very well published people in the field. So if you've published quite a bit on the particular topic of a paper that we have under submission, then you'll be on our radar essentially. I think it's always useful to flag up if you have a particular expertise that you think might be lacking. But overall, as I say, you will be on our radar if you're publishing in areas that we publish on.
We usually try to use people, so we usually don't use any one referee too often because they're busy people.
Yeah.
And if you want to stay on the list of people to be used, then get your referee comments in on time.
Great, thanks very much. People want to know also if they're rejected, what advice can you give them with regard to submitting their articles somewhere else? And also, do you know of any assistance, particularly for folks in low to middle income countries, with regard to accessing funds to get published?
Okay, so first question. I think if we reject a paper and it basically just says, sorry, we haven't been able to prioritize your work, you'd be within your rights to reply to that editor and say, would you mind giving me a little bit more direction? What was it about my paper that didn't quite make the grade? Can you suggest another journal? And I'd be really happy to do that. So if we haven't already transferred or suggested a transfer of your rejected paper to another journal within our family, we're happy to enter into a slightly more personal discussion by email about another journal somewhere else that might be suitable, or just give you a few hints on what it was about your paper that didn't make the grade for us.
Probably as a rule of thumb, if you've been rejected without review, so a desk reject on editorial criteria alone, then you probably need to shoot for a discipline-specific journal. You're more likely to be successful in a discipline-specific journal, because you probably haven't been able to haven't conveyed that kind of wider impact. So you're more likely to get published in a more technical discipline-specific journal.
Yeah.
But as Zoe said, we're happy to kind of try and provide more specific advice if people are interested.
Yeah.
In terms of the funds for publishing fees, it depends a little bit on where you're based. If you're based in certain countries, which I don't know if you know the list of,
the Hinari countries.
But if you're in the Hinari countries, then we waive the publication fee.
That's right.
For open access anyway. Yeah. So and we do have a policy where basically if we think a paper's good, I don't think we've rejected one yet because of an inability to pay.
Absolutely,
basically. So I wouldn't worry too much about that. I would just, if you think you've got exciting work, send it to us, and we'll worry about that.
Yeah, I think that's one of the nice things about having editorial independence from the publishing side. As editors, we're not thinking about the money at all. So we haven't, as Al said, I think it is correct. We've never not published a paper because the author ultimately didn't have the money. We can work something out.
Oh, great. Thanks so much. A lot of the folks who are actually on are from low and middle income countries, so this is very helpful. The next question is, well, two actually. I'll put one, Zoe, to you, and then to Alistair. Zoe, what's the quickest, most effective way to choose which journal to submit an article to? And Alistair, after that, if you could answer, what's the average time it takes from a paper being submitted until an author knows that it's being accepted or not?
Okay, so the choosing your journal, that's a good question. I mean, I kind of know my own aims and scope, but I don't know all the journal's aims and scope. But I think there are various ways you could do that. But I know that Elsevier has something. Elsevier publishes our journals. It has a thing called Journal Finder. So you can go to, if you search for Elsevier Journal Finder, there's a kind of little algorithm that will help you to find a suitable journal. It will just be within Elsevier's portfolio, but I imagine other publishers might have similar things as well. So if you kind of Google Journal Finder or something like that, there are things that to narrow it down. Maybe we'll move on to the next question.
I think probably the most important thing is to come back to this notion of who you're trying to speak to, and just try and think about, what's the audience that you're trying to reach, and then try and identify, that's your kind of first question. Then you try and find a journal that's likely to be read by those people.
Right. Yeah.
In terms of how quickly do you know? So if the first hurdle, editorial bar, so if we decide not to review your paper, it's usually within a week. You're likely to find out. So it's quite, it doesn't hold you up very much if you think, well, maybe this is a Lancet paper. Let's send it and see what they think. And they say, thank you, but we don't think there's quite enough new insight here. And then you can just send that on to the next another venue, assuming it doesn't find another one in-house. And it doesn't hold up your publication process very much. In terms of after peer review, so will you find out if it's a reject after review, or is it going back for more review, or is it an accept? is probably, it's a bit variable because obviously not everything's within our control, but let's say a month to 6 weeks for the first round. Would you agree with that? Thereabouts?
I think it does depend on journals a little bit, but yeah. So yeah.
Thereabouts. It obviously depends. Sometimes it takes longer because referees don't get back to us, or because it's particularly complicated and we need to find an extra referee, or that, you know, sometimes it takes longer. But normally you would find out after peer review in that sort of time frame whether it's going to go on or whether it's going to be rejected.
I think as a rule of thumb, I would say 3 months from submission to acceptance.
Yeah,
roughly.
thereabouts. Yeah. Again, it depends on if referees require substantial revisions and then the authors need to actually go away and do that work, and they've obviously also busy people that have other jobs to do, then that can really stretch things out. So if it goes to several rounds of review, that can easily be 6 months, 9 months, depending on how quickly people make those changes and how quickly the referees can get back.
Great. Well, thank you very much, Zoe and Alistair. I'll just turn it over to each of you for a 1-minute close in a second. But just as a few questions, I'll just wrap up and answer a few ones that we have here from some of you who are writing in. And thank you very much, everyone, for sending us your questions. If you have any questions for Zoe and Alistair, there's the editorial at lancet.com is a way to reach the Lancet. At CUGH, it's info@cugh.org. So please feel free to, if you have any questions, to send those questions through to that. And there will be a recording of this webinar, like all our webinars, will be on CUGH's website at cugh.org, and that will be up within a week. So we'll also send it out around the world to our 30,000 person network in our bulletin that you can sign up for, again, on our website. So with that, I'll just turn it over first to you, Alistair, for any closing comments, and then Zoe to you, and then I'll close up. Alistair, over to you.
Thank you very much. I suppose I would just finish with reinforcing the points that that's kind of editorial criteria that we're looking for in terms of the first thing we're trying to look for is conceptual novelty. So ask yourself the question, what have we found, where we know, and then what do we now know that's different? And then breadth of interest, how important is that for other people? How is that going to change something in the world? Those are there are kind of editorial watchwords. And, please submit your work to Lancet Planetary. We'd love to see it. And that's it. That's it for me. Thank you.
Thanks. And I think I would just finish by saying, re-emphasizing perhaps that if you don't get published in the Lancet or one of the Lancet's journals, it really isn't the end of the world. Please don't be demoralized. If your paper's sent for peer review and is rejected, what we hope we can do for you is to get a really good number of high quality reviews that you can then use to make your paper better and get it into the next best journal that you can possibly find. So it's fine, it's great to shoot for the Lancet, but remember that only 4% of those make it. But hopefully these techniques that we've been going through this afternoon can help you to maximize the chances of your work being published in the highest possible impact journal that you can manage. Thank you. Thanks for listening.
Well, wonderful, and much thanks to Zoe and Alistair for giving a wonderful presentation on speaking to the editors, getting published, and other insights into the world of global health. I'd like to thank very much Jenna here in our office at the Consortium of Universities for Global Health for doing, again, a great job of putting the webinar together. Again, for those of you online, there is actually also a journal database called globalhealthjournalsearch.org. If you want to take a look at a broader range of other additional journals, please feel free to do that. And again, once again, please come, if you can, to Washington, D.C. on April 17th to the 20th for our annual conference on global health in a time of worldwide political change. It'll be exciting, invigorating, and inspirational, and we look forward to seeing you then. So thank you once again, everyone, for queuing in to this series of webinars. And please tune in again on March the 11th when Zoe Mullen will be also having the second in a series of Lancet Global Health webinars, and that will be on increasing equity in global health. It'll be 10 a.m. Eastern Standard Time, March 11th. We look forward to seeing you then. Thanks for tuning in.